Concern tonight after 2 confirmed cases of monkeypox in Cincinnati.
They're actually among just 17 cases across the state confirmed by the CDC. Experts believe there are likely more, though.
WCPO 9 News reporter Jessica Hart spoke with an infectious disease specialist about what's confusing doctors. So, Jessica, what'd they say?
Tanya, the specialist I spoke with says monkeypox starts out like other infections. The virus causes mild like flu symptoms. You can also get spots in your skin, blisters and pustules, and a rash. And that rash doesn't have to be all over your body, and it can occur in different places, which is why Dr. Carl Fichtenbaum says it's confusing doctors.
The first positive cases of monkeypox have been traced to Cincinnati.
We have 2 confirmed positive cases in the city.
There are currently 3,591 confirmed cases of monkeypox in the U.S. In the tri-state, Indiana has 33 monkeypox cases, Ohio has 17, and Kentucky has 6. And there are likely more cases.
There are probably people who have cases that are very atypical, and so they're not even being tested.
Dr. Carl Fichtenbaum is a professor of infectious diseases at the University of Cincinnati and UC Health, who says the lack of testing is a problem, but that's not the only issue.
And right now, vaccine is being limited to those people who are close contacts who may be considered high risk for developing monkeypox.
We're getting lots of requests directly from providers who are requesting vaccine because they have patients that are coming to their practices saying that they were exposed to monkeypox or a person with monkeypox, and they are requesting the vaccine through us. So we're getting more calls.
Fichtenbaum says a lack of resources is why he thinks the WHO declared monkeypox a global health emergency.
When you list an emergency, what that does is it sends an alert to countries to enlist the support of their public health system to try and contain the spread of a disease.
He says there are certain high-risk groups such as gay and bisexual men, with the risk being low for the majority of the population.
For most people who live in Cincinnati, they're probably not going to come in contact with monkeypox. So I don't think it's the time for anyone to push the panic button.
And he says it's important to note it's not strictly a gay disease.
Of course, anybody can get it if you become in close contact with someone else who has it, particularly skin-to-skin contact. It doesn't matter who you are.
Dr. Fichtenbaum says the virus spreads by having close contact with other people. He says there is a treatment available called TPOXX. It has limited side effects. Right now, it's being prioritized for high-risk individuals since there's a limited supply. Tanya, Craig?